I'm here at Renovus Medical Day Spa in Johnson City talking with my old friend, Dr. Don. Don, we've been doing this, about 8 years now?
About that long, yes.
And you think you know somebody. I did not know until this very day that you started out in OBGYN.
Correct. That was my first love way back when, years of it in and everything, and started in with training and residency, internship, and whatnot.
But you've been doing this for...
Dermatology for over 40 years.
Okay.
But developed a problem with allergies, so I loved OBGYN. I really did surgeries and everything like that. And because now I'm in dermatology, I'm actually going back to my old roots.
Okay. And having said that, we're going to be talking about a matter that some might find delicate or sensitive. So there's your warning. So we're going to be talking about...
We're talking about vaginal tightening for urinary stress incontinence, okay? So as you age, after having multiple kids, or sometimes getting older too, things start getting loose in the vaginal wall, so that you get some laxity, some relaxing whatnot, and just not quite the strength support you had. And so the bladder wall here kind of gets loose and kind of protrudes down just a little bit. You lose this sharp angle so that when you cough, sneeze, lift up the grandkids, go for long walks or giggle or something, you can have a little bit of leakage, and some women have a lot of leakage. And prior to this, we talked about having to do surgeries. You know, we get out for days or weeks with that with some success. Unfortunately, we've all heard the vaginal mesh issues that are scary. But also, you talk about the exercises, the Kegel exercises. It's almost impossible to do them correctly. They can be done, but very difficult and time consuming and takes a long time to result. Or with 3 easy treatments, painless, a month apart, we are completely resolving mild to moderate stress incontinence. And the ladies are coming up, like a patient told me a couple months ago, is for the first time she's able to lift up her grandkids without worrying about it. Another was able to get on the trampoline with her grandkids without worrying about it, although I worry about her on the trampoline.
And there are a lot of commercials out there for products that women can use, and a literal Band-Aid for this problem, when you can solve it and not have to worry about that.
You can solve it, and it is completely painless. We use a little instrument, okay, and again, remember, I started off OBGYN, plus I have a nurse practitioner also that's able to do this treatment also. But with using this, we're able to use heat. So this is very similar to the other items, other procedure used to tighten skin around the face, the neck, and everything. But using this, we're able to treat the external area of the vaginal wall to take care of that, but also internally, okay? And it's able to put moisture back in the vaginal wall also, because as you get older, that gets very, very dry. This puts moisture back in. If you have problems with aging, this makes it young again. I mean, it takes years and years off of that. And so, there's no downtime.
No pain?
No pain, no discomfort, no complications. It's blown everything else out of the water. I mean, this is the greatest thing that we've seen come across. So for the stress incontinence or any other issues you have as you've gotten older and things aren't working right or looking right or acting right, come on in, free consultation. We can talk about it. But again, one treatment a month for 3 months. Following the first treatment, most patients are noticing significant improvement and can't wait for the second treatment.
So to borrow a phrase from Bill Gatton, why in the world would you not?
Exactly. If you have the anatomy and it's not working right, we can fix it. We can fix it.
And as opposed to wearing a diaper or a pad that you've got a constant maintenance, constant money.
Correct.
And still constant worrying.
It's still constant worrying, and it doesn't really work that well. So if you're tired of, as you said, putting a Band-Aid on the thing, let's take care of it, okay? Again, mild to moderate. Now, if you're having severe problems, no, you're probably going to have some surgery, although that doesn't work completely, and chances are pretty good if you had to have the surgery, we can still go over afterwards and do this to take care of the little fine-tuning on it, too.
Okay.
So if there are issues.
So all they need to do is give you a call, set up an appointment for a free examination.
Free examination right here in this room. Okay.
And if they give you a call and let them know that they saw it here on the show, special pricing as well.
Special pricing. So you want to call today. Okay, we're having some significant special pricing for today. So call the office, 207-0154, and say you heard it today.
All right.
Okay. And like to make an appointment, we'll come on in, we'll talk, and if I feel like we can help you, that's fine. If for some reason don't think it will, well, that's fine too.
It won't cost them anything to find out.
Well, nothing to find out.
It's Renovus Medical Day Spa right here in Johnson City. Give Dr. Don a call and tell him you saw it here on Good Day.
Tell him Morgan sent you.
Yes.